The participants in this study were recruited from the Framingham Heart Study, both from the original cohort and the offspring cohort. So we looked on participants who were 50 to 75 years of age, men and women, and no rheumatoid arthritis, and hand-away data and data on mortality and cardiovascular events.
Okay.
So we had around 1,348 participants. We divided the participants into 3 groups based on their hand-away status. Symptomatic hand-away was those with radiographic OA in one or more joints and pain in the same joint.
Right.
Radiographic hand-away was defined as one or more joint with radiographic OA but without pain. And the reference group were those with no hand-away at all.
Right.
And then we looked on overall mortality and cardiovascular events. So we found no association between hand-away and mortality when we adjusted for age, sex, and other metabolic
And that's
factors.
just overall mortality?
Overall mortality,
okay.
yes. We also didn't find any association between hand-away and cardiovascular events overall when we adjusted for all the confounding factors such as age. Age was the main confounding factor in the analysis because the hand-away patients were older.
Right.
So in the crude analysis we found an association, but after adjustment for age, the association was not longer significant.
Okay.
However, when we looked on 3 specific events like coronary heart disease and stroke and heart failure,
Right.
we found a significant association between symptomatic hand-away and coronary heart disease.
And it was about a doubling of
Yes.
risk.
The hazard ratio was around 2.2.
Do you have any theories about the interaction between those 2 conditions?
We had some hypotheses. We
Right.
thought it could be due to metabolic factors.
Right.
So in the multivariate model, we included hypertension, diabetes, cholesterol, and the association remained significant after
Oh.
adjustment for these factors.
Uh-huh.
We also thought it could be due to less physical activity. If the patients also have OA in the lower limb, they could be more immobile.
Right.
But we also did analysis where we also adjusted for physical activity and also for pain in the lower limb, and the association was almost unchanged after including those variables in the model.
So it may be linked to inflammation?
Yeah, that's what we are thinking maybe.
Does this have any implication on screening OA patients for heart disease?
This is the first study showing an association between hand-away and coronary heart disease. So I think it needs to be confirmed in future studies.
Right.
But I think it's important that clinicians are aware that it could be an increased risk and maybe extra careful with preventive strategies.